Ever wish you had X-ray vision? Well, for neurologists, at least when it comes to nerves, that future might be closer than we think, thanks to something called neuromuscular ultrasound.
NMUS.
Yeah.
It's pretty amazing stuff.
Today we are talking all about NMUS
Yeah.
and how neurology residents are learning to use this powerful new tool.
Yeah, it's not science fiction anymore.
Right.
NMUS is really becoming more common in neurology for a lot of good reasons, and it allows us to actually see nerves in real time.
So for our listener who's, a healthcare provider or a medical resident, what's the big deal about NMUS? What are the benefits? Why should we care?
Well, let's imagine a patient comes in with symptoms of carpal tunnel syndrome, right? Traditionally, we'd have to rely on physical exams and, nerve conduction studies to kind of confirm the diagnosis. With NMUS, we can actually visualize the median nerve at the wrist and actually see if it's compressed, which is, a hallmark of carpal tunnel.
So it gives us a more direct and immediate look at what's going on with the nerve.
Exactly. And there was this recent Canadian study that looked at how neurology residents are learning to use this powerful tool. The study took place at the University of Alberta, and they had residents from all 5 years of training participate.
Interesting. What did they find out about how the residents were picking up these skills?
Well, they found that even with limited training, residents were able to achieve a pretty high level of accuracy using NMUS to measure nerves.
Wow.
And they focused on 3 key nerves in the study: the median nerve, the ulnar nerve, and the fibular nerve.
Okay, so for our listener, can you just explain why those 3 nerves are so important?
Sure. So the median nerve, runs through the carpal tunnel in your wrist.
Yeah.
It's often affected in carpal tunnel syndrome. The ulnar nerve travels down the arm and into the hand. Can be compressed at the elbow, leading to cubital tunnel syndrome.
Got it.
And then the fibular nerve runs down the leg and can be compressed at the knee, causing foot drop.
So these are nerves that are pretty commonly involved in conditions that we as providers would see in our clinics.
Absolutely.
Okay.
Yeah, and being able to assess those quickly and accurately with NMUS can really make a difference in how we diagnose and manage these conditions.
Yeah, that makes a lot of sense.
Yeah.
So this study that you mentioned that involved training residents to take measurements of these nerves using NMUS, how did they do? How accurate were they?
The results were really impressive.
Okay.
The residents' measurements were very consistent with those taken by an experienced neuromuscular specialist.
Wow.
And this was especially true for the median nerve at the wrist, which is, as we said, crucial for diagnosing carpal tunnel syndrome.
Yeah, for sure. That's encouraging.
Yeah.
It sounds like residents are able to pick up these skills effectively, but were all of the residents coming in with the same level of experience?
Actually, no.
Okay.
They had varying levels of prior ultrasound experience.
Okay.
Some had none at all.
Interesting.
But regardless of their starting point, they all showed significant improvement in their confidence and their understanding of the NMUS principles after the training.
So even if you're a resident who's never even touched an ultrasound machine before, you can still learn to use NMUS effectively.
That's what the study suggests, yeah.
That's great.
And importantly, it wasn't just about learning the technical skills,
Yeah.
The residents also expressed a lot of enthusiasm for the training.
Oh, wow.
They really saw the value in being able to use NMUS and felt like it was a valuable addition to their residency program.
I'd love to hear more about what they specifically found valuable about the training. Were there any common themes in their feedback?
A lot of the residents reported that it made them feel more confident in their diagnoses.
Okay.
They liked being able to visualize the nerves directly,
Sure.
which helped them confirm or rule out certain conditions more quickly.
Yeah.
Some even mentioned that it changed the way they interacted with patients.
Oh, really? How so?
They felt that being able to show patients the images on the ultrasound screen helped them explain the diagnosis more clearly, and it kind of fostered this sense of transparency and trust,
Right.
which is so important in the doctor-patient relationship.
Yeah, I bet patients are much more engaged when they can actually see what's going on inside their bodies.
Absolutely.
Takes the mystery out of it.
Yeah, it empowers them to understand their condition and be more involved in their care.
So we've got residents feeling more confident, patients feeling more informed. It seems like everyone wins with NMUS.
Yeah.
But what about those more challenging nerve sites? You mentioned some nerves being trickier to measure accurately right.
Right. While the median nerve at the wrist was fairly straightforward, some nerves like the fibular nerve at the fibular head were a little more difficult.
Okay, what makes those nerves so much harder to image accurately?
Well, the anatomy can be more complex.
Okay.
And sometimes it's just harder to get a clear image with the ultrasound probe. Even experienced sonographers find those sites more challenging.
Okay, so let's unpack this a little further. If you are a resident or even a practicing clinician who's new to NMUS, what are some key takeaways from this? What do you need to know to use this technology effectively?
Well, first, I think it's reassuring to know that you can acquire the basic NMUS skills relatively quickly.
Well,
This study showed that even a condensed training program can lead to, significant improvements.
that's a good starting point.
Yeah,
So it's not as daunting as it might seem.
definitely not. But second, it's important to be aware that some nerves will be easier to image than others.
Right.
So don't get discouraged if you find certain sites more challenging.
Okay.
Practice is key.
Makes sense. Practice makes perfect, as they say. And that leads nicely to my next question. What about the practicalities of integrating NMUS into clinical setting? Let's talk about that a little bit more.
Sure. That's a great question. Integrating any new technology into practice takes time and effort, but the good news is NMUS is becoming more and more accessible. Portable ultrasound machines are getting smaller and more affordable,
Oh, that's awesome.
making them practical for a variety of clinical settings.
Okay, so we don't necessarily need to have like a dedicated ultrasound suite or anything like that.
Not necessarily. No, a lot of clinics are incorporating it right into their exam rooms.
Oh.
It's about adapting the technology to your own needs and your workflow.
That makes it a lot less intimidating.
Yeah.
But of course, we need to know how to use the technology correctly.
Yeah.
So what about training opportunities for residents or even practicing clinicians who want to add NMUS to their skill set?
Yeah, well, there are more and more training programs becoming available all the time.
Oh, that's great.
Professional societies like the American Academy of Neurology and the Canadian Neurological Society, they offer courses and workshops on NMUS, and a lot of hospitals and universities have their own training programs.
That's really helpful to know. So if our listener is interested in getting started with NMUS, there are definitely resources out there to help them. But let's say you've had some training, you've got your portable ultrasound machine, you're ready to start using NMUS in your practice. What advice would you give to someone who's just starting out?
I would say start with the basics.
Okay.
Focus on mastering the techniques for imaging those key nerves we talked about.
The median.
Yeah, the median, ulnar, and figular nerves.
Okay.
Those are the ones that are commonly involved in the conditions you're most likely to see.
That's good practical advice.
Yeah.
So don't try to learn everything at once.
All right.
Focus on building that solid foundation.
Exactly. Once you're comfortable with those, you can gradually expand your skill set to include other nerves and more advanced techniques.
And don't be afraid to ask for help.
Oh, absolutely. Reach out to colleagues who are experienced, attend workshops, review the literature.
Yeah?
There's a growing community of NMUS practitioners out there who are happy to share their knowledge.
That's awesome.
Yeah.
So it sounds like integrating NMUS into practice is a journey.
Oh.
It's about starting with the fundamentals, continuously learning and improving, and being part of a supportive community.
That's a great way to put it. And it can ultimately lead to better care for your patients.
This brings us to the bigger picture. We've
Right.
talked about the benefits of NMUS for diagnosis, but you hinted earlier at its potential role in treatment as well. Could you elaborate on that a little bit?
Sure. So while NMUS is primarily used for diagnosis right now, we are starting to see its applications expand into other areas.
Okay.
For example, some clinicians are using NMUS to guide injections for nerve blocks.
That's really fascinating.
Yeah.
So instead of relying on anatomical landmarks alone, they can actually see the needle and the nerve on the ultrasound screen.
Precisely. And this can help ensure that the medication is delivered to exactly the right location, which improves the effectiveness of the block.
Wow, that's a game changer for pain management. Are there any other examples of NMUS being used in treatment?
Yeah, NMUS is also being explored for its potential to monitor the effectiveness of treatments in real time. For example, in carpal tunnel syndrome, NMUS can be used to assess how well the median nerve is decompressing after surgery.
So it's like having a window into the healing process.
Exactly.
That's awesome.
Yeah, and this information can help guide treatment decisions and ensure that patients are getting the best possible outcomes.
Okay, so we've covered a lot of ground here. We talked about how NMUS is becoming increasingly accessible, how residents and clinicians can get trained, and the potential applications of NMUS for both diagnosis and treatment. But this technology is still evolving, right? Where do you see NMUS going in the future?
That's a really exciting question.
Yeah.
The future of NMUS is full of possibilities, I think.
I agree.
We're likely to see continued improvements in ultrasound technology,
Yeah.
machines becoming even more portable and more powerful. We might even see the development of AI algorithms that can help interpret NMUS images.
AI in neurology.
Yeah.
That sounds like something straight out of a sci-fi movie.
I know it's pretty wild, but
Yeah.
on a more practical level. I think we'll see NMUS being used more and more for a wider range of neurological conditions. It could become a routine part of the neurological exam,
Wow.
helping us to make quicker and more accurate diagnoses.
And with the potential for NMUS to guide procedures and monitor treatments, we could see a shift toward more personalized and effective care.
Exactly. It's a really exciting time to be in neurology, and NMUS is at the forefront of all that excitement.
To wrap things up, what's the one key message you want our listeners to walk away with today?
If you're a healthcare provider who sees patients with neurological conditions,
Yeah.
NMUS is a tool you should seriously consider adding to your practice.
Okay.
It has the potential to really enhance your diagnostic capabilities, improve patient care, and ultimately lead to better outcomes for your patients.
That's a powerful message and a great place to end our discussion. Thank you so much for joining us today and sharing your expertise.
It's been my pleasure.
And to our listeners, thanks for tuning in. We hope this has given you a better understanding of the exciting world of neuromuscular ultrasound and its potential to revolutionize neurology.
Disclaimer and bibliography in the description.